Archives of Prasar Bharati presents the timeless treasure of golden era.
A healthy woman is the backbone of a healthy family and a healthy society. Unfortunately, women often neglect their health, either by choice or by compulsion, having long-term implications not only for themselves but the society, their family, and the future generations. Due to their biological makeup and psychosocial factors, women are more prone to develop certain physiological and psychological illnesses. In today's episode, let's discuss some of these common problems that beset the women and effective ways of coping with them.
There are many stressful factors in the lives of women, which includes strenuous physical work, the monotonous drudgery of working both within and outside the home, pressures to perform, and interpersonal tensions, which can lead to emotional disturbances. Besides the hormonal changes, along with other psychosocial problems, there are things that adversely affect her physical and mental health.
Women have been bestowed with a very special function of childbearing. Because of this, her body goes through a lot of physiological and hormonal changes. These changes often start in adolescence, that is puberty, and go on throughout her life.
Female children generally attain puberty at a relatively earlier age as compared to the male children. Boys have onset of puberty later than girls. The average duration of the pubertal years, so to say, is almost 4 to 5 years, and the changes are slow and gradual. In the female child, the most important pubertal changes are basically the shedding of the more lean contours and the addition of more fat to the body, the development of the breasts, the onset of menarche, and some degree of development of body hair.
People have to understand that if the fertilization has not taken place, then the lining of the womb will be shed, and it takes the form of bleeding, which is known as menstruation, and it comes every month. So this is a normal physiological phenomena which should not be looked down upon.
At the age of menarche, the girl who hasn't got the knowledge of menarche, the flow of MP and other things, she is actually worried and tensed up. If she is not made educated properly in this regard, she is prone to suffer from emotional disturbances.
Some women just before their monthly cycle have certain symptoms which is called as pre-menstrual syndrome. This is associated with a lot of physiological and psychological problems in these women.
I find that there are a lot of patients who come with menstrual irregularities. Physiologically, majority of them seem to be complaining of irritability, of getting very angry, mood disturbances.
I have been having a lot of problems during my period since the past 2 years. They are quite irregular, and the worst part is that just 2 to 3 days before the periods are about to start, my whole body aches. I feel very tired and lethargic. I cannot concentrate on anything, and I feel dull and low. I don't feel like doing anything at all. Every month when it's time for my periods, I begin to get apprehensive. This uneasiness goes on mounting as the date approaches. My periods last for about 6 to 7 days, and then I'm all right. But just before the periods, I have several problems. I have heaviness in my head. I don't feel like eating. I'm quite disturbed by small things. I become very irritable and don't feel like talking to anybody. I tend to overreact and become extremely touchy and sensitive during these days.
PMS, or the Pre-Menstrual Syndrome, is characterized by mood disorders such as irritability, easy tendency to weeping, getting angry, fluid retention, and in certain cases, in extreme cases rather, A lady can even become suicidal, but those are very, very rare cases.
Cause of this is the progesterone hormone, that is a hormone in the body which gets more in amount, and that causes fluid retention in the body, and this causes all this confusion and irritability and all these problems. So it depends on whether this problem is up to mild or moderate degree or a severe degree. If it is mild to moderate degree, again, first of all, we have to rule out that there is no problem, there is no other disease, but this is only premenstrual syndrome.
Meditation helps a lot in stabilizing the internal environment. Because it is hormonal, generally sometimes the progesterone levels phases are seen in predominance. So we would say that meditation helps to align this hormonal balance to its normalcy.
So besides reassurance, there are certain medications which can be given if the problems are acute, like diuretics. So they will reduce the amount of water in the body and these problems can be corrected. Then role of vitamin B6 is also important in reducing the congestion.
Vitamins, painkillers, tranquilizers or diuretics may be required, but only after consultation with a proper physician. Adequate rest, keeping oneself busy, listening to music, reading, and also having a support of others can also be quite beneficial. Besides this, there is another set of problem which is related to pregnancy and childbirth.
A natural consequence of marriage is conception. Pregnancy is not only a period of eager anticipation and subdued excitement for the couple, but also a time for the expecting mother to take adequate care of herself by undergoing the necessary prenatal checkups and medical investigations that will pave the way for a smooth and safe delivery of the newborn.
The news of a planned pregnancy leads to a lot of joy for the entire family, not only for the woman. But an unplanned pregnancy, and if followed by abortion, can lead to a lot of psychological problems for the woman. Pregnancy is also associated with certain other emotional disorders, partly due to hormonal changes and partly due to curtailment of activities and not being able to work.
This is my wife. We have 2 daughters and she's expecting the 3rd one. The main problem is that she does not feel like eating at all. Even if she eats, she is not able to digest.
At times I have pain in my legs. My digestion has also become bad these days. I can't eat properly.
Second phase of life, which is the fertility period, there she is again prone to different types of stress, mental stress especially, because she has to look after her children at home, then husband. If she's a working lady at the office, she has to convince everybody in the family and as well as in the office. So all this collectively keeps her tensed up throughout, and especially when she becomes pregnant, who is basically delicate, will be prone to develop the emotional disturbances which can result into mental illness.
Even sometimes preceding the delivery, the patient develops a bit of irritability, feeling that she's down in the dumps, feeling very sad, easily given to weeping without much reason around, and very fluctuation of mood. Sometimes she's normal, sometimes she's very, very unhappy, and generally prone to interpret whatever happening around her in the negative form.
In some women in the post-delivery phase, due to hormonal and psychosocial changes, there might be what is called as postpartum blues. In this, the woman may feel sad, dull, not wanting to do anything for herself or for the child.
Just 8 days after her delivery, she started having problems. It started with a mild fever, and then we don't know what happened. She wouldn't sleep, nor would she eat. She would just keep sitting and wasn't in her senses. At that time, I felt as if somebody was cutting me into pieces. I would hear strange voices and see scary figures. I have gone through a lot during that time.
We should be observant about the mother who was delivered during the first month, about the signs and symptoms of psychiatric illnesses. For example, false beliefs that somebody is poisoning, false beliefs that somebody is talking about the person in a derogatory manner, false belief that people are trying to laugh at her and trying to make her a laughing stock, or various other kinds of beliefs which we call delusions.
Sometimes this can be quite severe, but it can be helped with medication. There could be other kinds of emotional disturbances also in the post-delivery phase. All these require the help of a mental health professional.
These antipsychotic drugs are good enough in resolving these syndromes, these disorders, in a very, very efficient and effective manner. And in a few weeks' time, the person comes back completely to his normal functioning mostly.
Menopause is a normal age-related change in women associated with certain physiological and psychological changes. If it is severe enough, then it is called menopausal syndrome, requiring the help of a professional.
Menopause is a period, that means the cessation of menstrual flow. So it is a normal physiological process which happens in every woman's life. Usually it occurs between the age of 39 to 58, but the average age is between 45 to 50.
I am 50 years old. My main problem is that I have irregular periods. At times they come after 2, 4 or even 6 months. Besides this, I also feel very anxious. I get dizzy and have hot flushes. I begin to sweat a lot and have an upset stomach.
The common symptoms during menopause are the woman gets irritable, they get fatigue, tiredness, headaches, giddiness, then they get hot flushes, that is they feel very hot in the palms and sole. Then they get depression. So they start feeling that they are no more young, and perhaps that is the cause of depression, and they feel they are going towards the old age.
Women feel that when menopause sets in, they are losing their femininity and generally are looking less attractive. But really, this is not the case. This is a normal process of the body, and the best way to look at it is to accept it. And the more acceptance, the easier it becomes, more natural it becomes, and the more pleasant it is to get on with life.
Only if the doctor prescribes, then certain medications can be given, like antidepressants or the mood elevators, that too for a short period, so that the patient feels energetic and active again. Then physical activities, exercises, and these days yoga is playing an important role in combating these disorders.
Often the potent combination of biological vulnerability and psychosocial stressors may leave women victims with crippling psychiatric disorders such as depression, anxiety, or psychosomatic illnesses.
There are multiple roles of a female that has to be played by an Indian woman that makes the woman prone to develop some psychosocial problems like depression, anxiety, insomnia disorder, tension headaches.
Depression is the commonest emotional disturbance which is seen in women. Actually, depression is much commoner in females compared to males. It could be related to genetic vulnerability, psychological factors, or due to certain changes in their menstrual cycles.
Earlier, I used to feel like working, but since about 4 months since the time my problems have started, I don't feel like doing anything at all. I just feel like lying down throughout the day. Because of this, I would worry a lot. I would feel depressed and start crying. I would feel slightly better after crying, but then the problem continued. Physically also, I did not feel like doing anything at all.
The person doesn't talk with anybody, the person doesn't take interest in anything, doesn't eat also, doesn't sleep, simply sits in one corner, or likes to be aloof in the dark room. And a lot of crying spells will be there. And many times they will say that it is a worthless living. What is the use of living? Why not I die? So these are all common features of depression.
The next disease that is common in women is an anxiety disorder. There are various kinds of anxiety disorders, and females are more prone to develop them as they have multiple roles. There may be some biological hereditary factors that also predispose the women to develop such kind of anxiety problems.
I feel extremely anxious, my mouth becomes dry and I feel like drinking water all the time. I don't feel like eating and I still need medicines.
Whenever a person is anxious, the person becomes very tensed up. The person becomes tremulous. When the person becomes restless, the person complains saying that I have dryness of the mouth. I start sweating a lot in the palms and soles.
There are a lot of other emotional disturbances like phobias, obsessions, and psychosomatic illnesses that are frequently seen in women.
I personally believe they are all related to the stress. What to talk of the normal physiological phenomena, even the abnormal diseases where the disease is disturbed, for example, like cancer, even hyperacidity, irritable bowel syndromes, even hypertension, coronary artery disease, stroke, even the cancers and recurrent infections are also related directly and indirectly to stress.
Other common disorders which are found in females are adjustment disorders. The females, as they are more sensitive and emotional as compared to males, they have a more tendency to verbalize their emotions, and that's why they are more prone to develop adjustment disorders, interpersonal problems, marital problems.
Psychosis or psychotic disorder is a serious form of a mental illness in which the person loses touch with reality. Now, in this kind of a condition, there are three basic changes which take place. One is a change in behavior, which means that the person or the patient might start showing certain odd behaviors or mannerisms which the family is not able to really comprehend. Another change is a change in the emotions or a change in the way the person feels. Now here there could be moments when the patient suddenly starts feeling extremely sad, depressed or dull, or she might suddenly become very excited and happy. Now the third prominent feature of a psychotic disorder is a thought disturbance. Here what happens is that the person starts having certain false ideas or beliefs or certain misconceptions.
First, listen to me. It has happened to me. I was in the stadium in Delhi. I am an actor. My brother is a director. That is all that I know. So what if the photographs were not taken?
My husband, Dr. Vishnu Devro, 100-degree doctor. He is a Vishnu Devro, and then he is coming from a village. Arasikara Vishnu Devro, Britain and Charles II Dattu son. I am raped from 8th standard. I am raped from 8th standard. Now we will be having 32 children.
About 4 months back, she suddenly became very talkative. She would shout irrelevantly and throw away anything and everything that she could find. She could not sit in one place and was so restless. It became really difficult to control her, and that is when we brought her to the hospital. We were told that she has developed a psychological illness.
Whatever the kind of psychological or emotional disturbance, it can be helped with timely intervention. If the symptoms are severe enough, help of a mental health professional is required. Medication may be required for some time depending on the severity and duration of the symptoms. In certain cases, other kinds of treatment may also be required.
If the females realize that they have some psychological disturbance or a psychiatric illness, the very first thing that they should do is to verbalize their symptoms or their psychological problems to any confident, close person. If they feel that their symptoms still persist and they are unable to get rid of their anxiety or depression, and if they feel that their symptoms are increasing in severity, then the females should go to their general family doctor.
Once the acute phase of the illness is over, it becomes extremely important to counsel and do some kind of a psychotherapy with the patient. Along with the patient, it is important to counsel the family members also. So psychoeducation is what is extremely important, wherein the family members are explained as to what the illness is all about and how best to deal with the patient.
The family members are supportive, caring, loving. At that particular moment, when the psychologically disturbed female requires more help, then the severity of the psychological problem or disturbance is diluted and the severity is decreased, in fact. And this in turn makes the female's social and occupational performance better.
And I think the women today is facing a lot more stress than it used to be many years ago. And the only way to live in the society with stress, we must take it like a challenge and take this stress as a healthy stress. Then we will not have much diseases in the women.
The family and the work environment can lend a lot of support to reduce these symptoms of emotional distress. For minor psychological problems, relaxation techniques, keeping oneself busy and having a sense of self-worth is very, very important. That is how a person can not only get rid of one's emotional disturbances but also achieve self-actualization.
The path to recovery for an emotionally traumatized woman does not stop at getting medical help, but in further instilling a sense of confidence and achievement and the offering of sympathetic support by the family members.
A physically strong and mentally happy woman would be able to look after the needs of her family also. That is why it is important to attend to a woman's problems immediately. This would not only prevent her from developing disabling or chronic illnesses, but would also ensure health of the entire family.
Silent in your tears, wasted in your years. When you cry alone. Recourse to fantasy, living with insanity. Another night beside the phone. Let your mind feel the pain. Seek your meaning by my watch. Cage the war within. Addictions in the bin. Curl up with your memories. Togetherness and harmony.